Hello, everyone, and today we're going to talk about dealing with injuries and the various myths we've got regards to rehabilitation. Now, all of you guys are someday going to face some injury. It's kind of inevitable. I don't see anyone who's not has any joint. It's something as small as a finger sprain. It could be a ligament injury. It could be a dislocation. It could be anything and everything. It could be an entire fracture. It could be osteoarthritis. Something or the other is someday going to happen to you, and it's going to take a toll on your joint health and your bone health. So I see a few comments. I'll be addressing them eventually, but first, let's cover the topic that we have in hand. And how do we deal with these injuries? What is the specific rehabilitation protocol? Now, when we get injured, the first thing that people do is they start icing their injuries. I've seen a lot of guys who, when they get ankle injuries, they tie their laces very tightly. These are all old school practices. Do they work? Maybe. But there's better data now which suggests that these practices are better off not done to ensure that you've got lesser chance of recurrence and faster rehabilitation. So I'm going to run you guys through this quickly and in good detail so you guys understand exactly what to do whenever you get an injury. So you start off with healing injuries and the myths on icing and rehabilitation protocols. Now, how do we go to the next slide? Wait a second. Yeah. So when you get an injury, it's generally of two types. It could be an acute traumatic injury. Acute traumatic as in something that has happened recently or due to an immediate cause. And traumatic basically means due to impact, injury, or accident. So something like ankle injuries while playing a sport, maybe football, maybe basketball. Knee injuries while playing a sport again, could be any sport, badminton, weightlifting, probably because of poor squatting technique, could be because of anything and everything, which can translate into ACL tears, meniscus tears, and even dislocations. So shoulder dislocations, hip dislocations. You could have acute traumatic injuries and you can have chronic overuse injuries. Now, chronic overuse injuries specifically at the gym are of two types. You've got shoulder impingement, you've got rotator cuff injuries, basically shoulder pain while doing any sort of chest exercise is something a lot of people experience. So that could be considered into chronic overuse injury. And then we've got wrist pain, elbow pain, shoulder pain, even knee pain when you do too much of squatting. So these are the two types of injuries that we have got: acute traumatic injuries and we've got chronic overuse injuries. Now, what happens when you get an injury? Your, especially an acute injury, your area or your point of injury starts to swell up, right? You get inflammation and you also decrease range of motion. For example, I cannot show you any other joint, but I'll show you my finger. Let's say you jam one of your fingers. Maybe while playing basketball, you got a ball the wrong way and your finger got jammed. Now, in this case, this finger is going to swell up and you're going to reduce some range of motion. So if this finger can do this, probably your injured finger can only go till this range of motion, right? So you're going to lose some range of motion. You're going to feel a lot of pain trying to push through that range of motion, and this area is also going to swell up. Now, what most people think is that we need to decrease the swelling, we need to decrease the inflammation, and everyone thinks inflammation is bad. But that's not the case. Inflammation is not bad, inflammation is great. You want inflammation, and I'll tell you why. So, what inflammation does is when you've got a swelling at the point of your injury, it releases inflammatory factors, factors like cytokines, interleukins, and tumor necrosis factors. All of these scientific terms, small chemical mediators of inflammation, which are responsible for healing eventually. So, when you get an inflammation or some swelling, you increase blood flow because of that inflammation at that point. There is some endothelial increase in vascularization around the point of injury, which adds to more blood supply to the point of injury to ensure faster healing. And inflammation practically helps the joint heal faster. All right, it gives it more blood supply. At the same time, it removes tissue which is probably necrosed or dead or injured. So there is removal of any tissue which is probably injured or dead or not functioning properly, and it also initiates the process of healing. So initially what happens is when you get a wound or you get a bone injury, that injury first heals, first inflames, and then it starts healing. So inflammation is what initiates the process of healing. So inflammation is not bad. This is a very poor misinformation that is spread across the internet, across physiotherapy textbooks, across a lot of medical textbooks. So according to latest research, inflammation is something that is good for you. You don't want to avoid inflammation, because if you avoid inflammation, that's going to delay healing and also increase the chance of recurrence of the injury. How many of people who get knee injuries get a lot of recurrence in these knee injuries? One of the reasons of this is, of course, the way they use the joint, maybe due to another sport injury. But one main reason is improper rehabilitation. If you don't rehabilitate your injury well, the chance of recurrence increases. So inflammation is not bad, and what people do is that you want to counter inflammation. The second you get an inflammation, you want to start icing the joint, and then you just go for complete rest. You're in bed rest for like 30 days if you've got a knee injury or a hip injury, and you don't move at all, and you take anti-inflammatories. Common anti-inflammatories I've seen people take are muscle relaxants, which have diclofenac. I've seen people take ibuprofen. Now anti-inflammatories, or specifically NSAIDs, non-steroidal anti-inflammatory drugs, are good for reducing pain. But the problem with that is they don't just reduce pain, they also reduce inflammation. They try to do all of these methods to reduce swelling. While this can be okay in some cases and in some injuries, for most rehabilitation techniques, icing, anti-inflammatories, resting, and reducing pain is not the way. You should not do that. So people assume that swelling needs to be removed. And before we come to how and why, let's first talk about the research that I'm going to run you guys through. So people ask, okay, now we've got research. All right, I could say, okay, this research says icing is good, this research says icing is bad. Now, because most research says icing is bad, you should avoid research. Is research black or white? Is there a study which says, okay, icing is terrible, it's useless? Or is there a research which says icing is great, it's perfect? No, there is no black and white in this area. There is a gray. And the topic is still controversial in scientific spaces, but if you take even a little bit of understanding of basic physiology, you can combine all of that to understand why inflammation is not at all it should not be removed from your injury, because that's going to delay the process of healing, and I'll come to that. So the data is not very clear, okay, that this is definitely much better. It's more of that it's better off if you avoid not icing or not using anti-inflammatories. There is going to be some data which says, okay, taking anti-inflammatories is going to reduce your pain, icing is going to reduce your pain. But do we want to reduce the pain? We might reduce the pain, but the healing gets delayed. That is something we don't want. So I'll come to the data now. So by icing or any of these methods, we try to reduce inflammation because it does two things, right? It relieves you of pain. If you've got too much pain, then it helps relieving that, and it reduces swelling. Now, both of these are problems. These are not good for the integrity of the joint. Yes, reducing pain might feel good to you. You might not be at discomfort, but over a longer period of time, reducing that pain is not something that you should be doing, at least in the case of soft tissue injuries. And there's multiple reasons for that. For example, let's say you get a joint injury, right? And you've only got this much range of motion, and after this range of motion, any kind of flexion is hurting you. Okay, you're getting pain in this range of motion. But let's say you ice this area and you use anti-inflammatories and you stop feeling that pain. Now, the reason you had pain in this range of motion in the first place was because your body does not want you to go in that range of motion, because that might damage the joint more. But because you're forcefully reducing the sensation of pain by regulating the nervous system, you're allowing yourself to explore ranges of motion that your body does not want you to explore. And that is one reason why reducing pain is not always good. Yes, maybe for those people who are in very intense, intolerable pain, that can have further complications. So in that case, using some icing or using an anti-inflammatory or anti-pain or pain relief medication is something that you can do initially to ensure that it doesn't cause any pain related complications if the pain is very severe. But if the pain is mildly discomforting or even discomforting, at least not severely discomforting, then in that case it's better off that you tolerate the pain than you try to relieve it by methods that might compromise the joint integrity and the joint healing over the long period of time. So you don't always want to reduce swelling, you don't always want to reduce pain. There's two papers that I would specifically like to call out here. There's much more data on this. I haven't cited everything, but Seng et al., it showed that when you're icing your injuries, it delays the recovery process, especially when you ice your injuries in the initial stages, right after getting the injury. It's going to prolong the duration of recovery. Number two is that it decreases inflammatory markers. So there's a way to test inflammatory markers in your blood or in the area of injury. So it's seen that whenever you ice your injuries or you use any anti-inflammatories, you end up decreasing these inflammatory markers, factors that we discussed like cytokines or interleukins or tumor necrosis factors. So these factors are responsible for initiating the process of healing eventually, and reducing these factors is going to compromise the overall improvement in joints. Now, it also has shown that in athletes who experience muscle soreness, it might help relieve pain, it might help get rid of the pain and fatigue, but it causes slower muscle regeneration. So people who damage their muscles during exercise, which causes soreness, the recovery of those muscles get prolonged because of using methods like icing. And then we've got Dubois and Esculier 2019, where the peace and love method was mentioned, highlighted, which showed that icing and anti-inflammatories have very poor evidence. So peace and love is a new rehabilitation technique. I'll come to that in a while. I'm pretty sure that all of you guys are familiar with ICE, RISE, PRICE, or even police. These protocols, which are generally used for rehabilitation. But peace and love is something that is modern. It's a better formula, a better formulation of rehabilitation methods. I'll come to this in a while too. So then we've got data on anti-inflammatories. This paper by Jay, I'm not sure if this is Jay, I think it's probably Jay Hurtle, highlighted that this topic is still controversial. Like I said, there's no black or white, there's a lot of gray information, but it says that anti-inflammatories, they reviewed multiple papers which tested the efficacy of anti-inflammatories, and eventually they decided that okay, you need to have a very good assessment before using anti-inflammatories, because in most cases it's not worth it. Now the best part is that you were taking anti-inflammatories for reducing pain, but there are multiple papers, Fredberg, DuPont, Bahamonde and Savitri. These studies show that anti-inflammatories don't actually decrease pain as much as you think they would in soft tissue injuries. So I'll tell you a story. Recently, I had a friend who got injured, and we took him to the hospital at 4 a.m. in the night. First thing the doctor prescribed was putting a shot of diclofenac in the shoulder. Now, this guy was able to bear the pain, okay? It wasn't intolerable. And that diclofenac shot was not necessary. Diclofenac is an anti-inflammatory. Now, what we've seen is that as compared to placebo, these pain relieving medications sometimes end up having no difference whatsoever. So you're compromising joint integrity for a potential of relieving pain. So then we've got more studies. Slatier et al. Showed that when you use icing or when you use anti-inflammatories in initial stages of the injury, that increases the recurrence rate. Recurrence as in, if let's say you've got a knee injury and you heal the knee injury and that injury happens again. A lot of people face this, especially with ACL tears or meniscus tears. The increased recurrence rate can be due to a use of anti-inflammatories in the initial process of rehabilitation. Then it also advises against acute administration of anti-inflammatories. Acute administration as in within the first 3 days or on the day of the injury. So again, anti-inflammatories, they reduce pain. They've got two jobs. Okay, they reduce the pain also. They've got a pain relieving um, um, performance or pain relieving action, and at the same time they're also anti-inflammatory. That's literally their name, non-steroidal anti-inflammatory drugs. So reducing inflammation can be helpful in certain inflammatory conditions where the inflammation is because of a pathological reason, something like gastrointestinal inflammation. In these cases, you can try out NSAIDs, or maybe renal inflammation. You can use NSAIDs to reduce inflammation in certain cases where there is pathological inflammation. But if there is inflammation because of an injury, which is not pathological, that's traumatical, it's due to an accident, it's not because of a pathology. In that case, using anti-inflammatories doesn't make a lot of sense. They reduce pain, but they also reduce inflammation, which is not something we want for long-term growth. So what do you do instead of using anti-inflammatories and instead of using icing? Another mistake that a lot of people make is resting, right? A lot of people, I see them, they've got an injury and they spend 30 days 50 days bed rest and barely moving at all, barely active. There's one guy at my court, okay, he got injured like 3 months ago, ACL tear. He did one surgery and after that he's not moved at all. So if you don't do a lot of stuff for your mobilization or your rehabilitation, it's going to take longer. Yes, it will happen, but it can also happen shorter and it can also happen better. You will end up recovering, but over a longer duration, and you will still have a higher risk of recurrence as compared to someone who does everything possible for their joint rehabilitation. So what you should do instead of resting is try to mobilize the joint, mobilize the injury as early as possible. So how many of you have got your finger jammed? I'm assuming practically everyone here. Whenever you get your finger jammed, what do? You keep on trying to, see how much range of motion has increased, right? Eventually, first day you cannot move this at all. Second day you try to, squeeze it a bit, see where the pain is coming. Reach a threshold where you're able to tolerate a little bit of pain, but you don't, extend or do something very massive. And then you also, eventually after say 5-7 days, you end up being able to close your entire finger or flex your entire finger till the time that you get that range of motion back, but you still feel some pain if there is some trauma or there's some pressure or you accidentally bump your finger into something. So this mobilization is something that helps the injury heal faster. Okay, so instead of resting, you should spend more time mobilizing the joint, loading the joint as much as possible, compressing the joint, elevating the joint. And I'll give you two examples. There was one athlete who had complete ankle tears. I've got his photo attached in the end of this presentation. So I've got an athlete who had two ligament tears in his ankles, not two, I think three complete ligament tears, and he came back to the sport within a month. Okay, just by virtue of showing up to court every single day and doing whatever he can do in a pain-free range of motion. Yes, you want to avoid pain, you don't want to explore ranges of motion where you're feeling pain, but it's also very important for you to mobilize the ankle, mobilize the injury as much as possible. Then remember childhood, right? You used to play sports, you got an injury, but because you wanted to play, go out and play some sport with your friends. I'm not sure how many of you all played sports, but if any of you were athletic and got some sort of an injury, you were always restless to play even when you're injured. And the fact that you were moving as much as possible helped you recover faster. Not and it didn't take longer for you to recover. So it is good to be active, to be mobile. Then what do you do instead of icing? You can do heat application, you can try out saunas, you can try out warm compressors if you don't have access to a sauna. Heating actually improves the vascularization, it improves the blood flow to the injury. So it just makes sense logically. It is going to increase the blood to your injury, the injury is going to heal faster. Also, by the way, joints have very poor blood supply, so the more things you can do to add blood supply to your joint, the better it heals. Then you can do some mobility. You can start loading the joint with resistance bands, with your hand as resistance. And if you've got injuries, you can start loading the joint in pain-free ranges of motion. You can also use this technique called flossing. Now you might be thinking, what flossing? You floss your teeth, right? This is a different type of flossing. There's floss bands. I've got one right there. I'd show it to you, but it's a bit far. Just go to YouTube and search flossing your knee joint or flossing your shoulder joint. You'll get a video. There are floss bands which look like resistance bands. They also help improve joint health and recover from injuries better. This is something that you should be doing instead of just sitting and resting. I'll tell you exactly how you need to rest. Now, rest is not completely useless, but it's not something you should do for a very long period of time. I'll tell you how to do that. Now, then you can also do light massages, massages that don't hurt but feel fine. If you've got some sort of a torn muscle, then in that case it's very hard to massage tightly. Like you can completely press your muscle. In that case, you can just use your fingers to massage it. Anything to increase blood flow, anything to relieve the pain. So instead of using anti-inflammatories or icing to reduce pain, you should just try to relax better. You can take supplements like magnesium for better relaxation, and you can start massaging your joints or your injuries a little bit more. Then we've got recovery objectives. Whenever we're trying to recover, what do we want? We want fast recovery, we want low recurrence, and we want as less mobility loss as possible, right? So what rehabilitation methods can we use? We've got general measures and we've got situation specific measures. Now, general measures are basically something you can do for all injuries, all soft tissue injuries. It can be muscle tears, it can be ligament sprains, it can be joint dislocations, whatever it is. Any soft tissue injury, you can use these general measures to feel better and improve. Now, whatever I'm going to tell you in the general measures is going to be something you can use uniform, but you also need to do some stuff which is specific to the sport you play, or specific to the injury you have, or specific to the range of motion you have accessible, and that requires a very detailed assessment. Okay, so this is very long. It's very hard to cover this because we need specific rehabilitation for shoulder joint, specific rehabilitation for knee joint, specific rehabilitation for hip joint. So this is something I'll be covering over my course Conquer. So you guys are probably wondering, what is Conquer? Conquer is basically my course where I teach students and fitness enthusiasts anything and everything about fitness, nutrition, exercise. So who is this for? It's for aspiring fitness coaches, it's for fitness enthusiasts, athletes, and content creators who are looking for mentorship in their fitness business. And what all do we cover? We cover medical conditions, diabetes, IBS, thyroid, uric acid. We cover nutrition, anatomy, exercise, content creation, scaling a fitness business, building a good mindset. And the best part, the highlight is the one-on-one mentorship, where you get lifetime access to the course. The lifetime access is going to be very limited, by the way. You get lifetime access to the course, and you get lifetime access to mentorship with me. So you can feel free to ask anything and everything that is going on in your life, or anything that you would want in terms of scaling your business or improving your growth. So do give this a thought, and if you're interested, the link is there in my bio, or you can message this number too. Then we've got rehabilitation plans. So we've discussed what all you need to avoid, what do you do when you start off with an injury, but now we'll talk about rehabilitation. So we've got some immediate protocols that we need to take care of. So let's say you get an acute injury. We're not going to talk about chronic injury specifically here, but let's say you've got an acute injury, you've got some inflammation. What do you do in this inflammatory case? You've got a swelling, right? You don't want to ice, you don't want to um, use anti-inflammatories until and unless you've got bleeding. And if you've got some internal bleeding, in all likelihood the area will get purple, or it would get hemorrhagic, and it would make sense to show to a doctor to see if there's an internal bleeding. If you've got internal bleeding, then using icing makes sense. But in most cases, in most simple injuries where you don't have any bleeding, the simplest thing you need to do is don't ice it, don't tie your laces too tightly, don't use anti-inflammatories, just chill. Okay, get back home, rest for 0 to 3 days, rest up to 3 days, see how you're feeling. It's going to hurt even after 3 days, but rest for 2 3 days, see how your joint is responding, and eventually the pain is going to subside. The range of motion is going to be slightly more tolerable. All right, after 3 days you start with overall rehabilitation. You do something in, so I've written 0 to 7 days, but generally it takes only 3 days of rest. It can go up to even 7 days of rest if you've got a serious injury. But you'll figure out when you need to stop resting, okay? And when you figure that out, stop resting. After that, 7 to 60 days, you want to start with mobilizing the injury. Okay, so how do you mobilize? You slowly first start to move the joint without any resistance. Once you can do that, then you start adding some load. You start flossing your joints. I'll come to all of this in a while too. And then after 60 days, or after you feel more confident, you can start regaining strength and start doing some sport specific stuff. So, for example, I had a basketball athlete who injured his finger, okay, like 3 fingers, wrist ligament completely torn, and he could not catch the ball because that hurt a lot. So what we started doing is, instead of playing a game where you get passes and you've got to hold the passes and hurt the joint, instead of doing that, I told him, just go to the court and try to shoot, because the pain was on extending the finger, not flexing the finger. So he went to the court, he got the ball in his hands, and he started shooting lightly. Anything that didn't hurt, he was doing that. So he started regaining some sport specific strength, and he started lifting weight. So let's say you've got a knee injury and leg extension just hurts now, and you can't lift 100 kgs which you used to lift. Start with 23 kgs, start with 20 kgs, 15 kgs, start with whatever weight doesn't hurt and slowly progress from there. Then we've got the previous outdated models that we used to use, that either you ice or you rise or you price or you police. So what is ice? Ice is icing, compression and elevation. Rise is rest, icing, compression, elevation. Then price is I don't even know, remember what P is. P was for uh, rest. Let me look this up. I don't even remember this. What is price? Okay, price was protection, rest, icing, compression, and elevation. And then we got police, and then all of these methods are now outdated. There's a better method now, which is peace and love. In peace and love, they removed inflammation, they removed anti-inflammatories, they removed icing, they made a much better protocol that ensures fastest rehabilitation. So this is not very popular now, by the way. There's a lot of stuff here which is still yet to be explored, but I'll run you through peace and love. So peace and love for an injury is, like I said, allow 1 to 3 days of peace. Let me just zoom in for you guys. All right. So 1 to 3 days of peace. You start with protecting the injury. Of course, you want to avoid anything that hurts, that can cause a prolonged increase in pain. Then you want to elevate the injured area higher than your heart to reduce swelling. Now, ideally, you don't want to elevate a lot, because you don't want to elevate a lot of swelling. Reduce a lot of swelling. Okay. Now, swelling would not directly compromise, elevation would not directly compromise blood flow a lot. So it's fine to do some level of elevation to reduce swelling and pain, but you don't want to do icing or anti-inflammatories to reduce inflammation specifically. So although ice is effective at decreasing pain, anti-inflammatories can disrupt the tissue healing process in the early stages. Then we've got compression. You compress the area with bandages, kneecaps, elbow braces, whatever you can use to compress the area. You can sleep with the compressions on, you can work out, or you can mobilize with the compressions on. And then some education. Education is basically trying to know everything you need to know about the injury and the joint. That is something you're getting in this video anyway. So you can seek out education and resources from a professional regarding how to approach a recovery. So you could speak to a physiotherapist. They might give you some exercises. You could educate yourself on that. This is kind of a, I think they just made this to fit the whole synonym to make it peace. Otherwise, it would be PEAC. And then you've got love. So after 3 days, once your injury pain subsides and you get some more mobility, you load your joints. You get optimism. So this might sound a bit boring or cringe, but optimism is actually great. There are a lot of people, after they get injured, they think, oh no, I got injured, it's going to take me so long to get back to my sport, I'm going to lose a lot of gains, and I'm injured, I cannot work out, I cannot walk. So this pessimism is kind of going to cause some nocebo effect, which might slow down your healing. So you want to be optimistic. Already you want to let as much placebo get to you as possible. So you want to be positive. If you're more confident about your injury, you're more optimistic, your brain will be prepared for better recovery. Then you've got vascularization. We're already doing a lot of things. So aerobic exercise, walking, flossing the joints, and mobilizing it as much as possible. And then we've got exercise. So load and exercise kind of are the same. So loading could start off with, let's say you've got a knee injury. How do you load your knee injury? You first start with flexion, extension. You move your legs without any resistance. Then slowly you start walking. You see which movements hurt. You first analyze that, or you could get it assessed by a professional. You see which movements hurt, and then slowly start exploring those movements. You could also strengthen the muscles which are around the knee joint. So let's say you've got a some sort of a knee injury where knee extension is hurting. All right, so you want to try strengthening the hamstrings. You want to try strengthening the calves. Any muscles that are around the knee joint, you want to strengthen them as much as possible. And then you want to slowly and gradually explore ranges of motion, explore movements, explore resistance which does not hurt. That will help you improve the condition of your injury and slowly start loading it and slowly start giving it some exercise. Then peace, that's practically about peace and love. So initially first 3 days you give it some peace. You take a chill pill, okay? Don't ice it. You can do some warm compresses, you can do some compressions, you can do you can avoid anti-inflammatories, you can elevate your injury, you can do all of that. But don't ice or give it anti-inflammatory. So initially, till the injury pain subsides and the trauma disappears, till then just take a chill pill, okay? Just chill. Then you've got love. After your joint is now back, it's back in the sense that it doesn't hurt as bad and it's not as terrible. Then you start with love. You start loading it, you get more optimistic, you start giving it some vascularization, and you start exercising. Then what else can you do? You can start supplementing joint health. So if you've got low vitamin D levels, get it up. You can supplement vitamin K2, you can supplement calcium, ideally calcium citrate malate. And then you've got omega 3s. You can supplement about 1.5 to 2 grams of combined EPA and DHA. Then you can supplement glucosamine, chondroitin, curcumin, um, even Pinko gel, MSM. There are a lot of supplements, joint health supplements. UC2 collagen, it's great. Type 1 collagen plus vitamin C, collagen peptide plus vitamin C. You would explore that. Yeah, so you can use all of these supplements for better joint health. And then you want to start being more active. Try to be on the go. If you've got office to go to, and you do some certain steps, you can get up in between your work and try to just walk. Let's say you've got a knee injury. Okay, we're just going to reference knee injury from now on. You're going to start doing some walking, you want to start doing some movement. You're going to slowly explore uncomfortable ranges of motion. Not painful ranges of motion, just uncomfortable ranges of motion. Then you explore, things in life which are not related to your sport. So maybe you've got certain things which you weren't able to focus on because you spend a lot of time playing a sport or working out as a gym. Now you've got more time in hand. So you can use this time to explore other things that you've always wanted to explore. So someone like me, my days are very busy. So I've purchased these two books, The Psychology of Money and Atomic Habits. I haven't been able to, read them religiously every day. So if I were to get injured, I would just take a chill pill, wait for the 2-3 hours of sport in the evening that I used to play. I would just ignore that and I would sit and read a book and read the books that I wanted to read, or just study a new topic, or plan out for an exam, or suggest study a subject, or study a medical condition that I wanted to read more about. So explore other phases of your life. If you've got a startup idea, start exploring that, and explore things. You've got time. Don't be negative about it. Don't be like, don't start sulking. Oh, I cannot play anymore. I cannot go to the gym anymore. Just chill. Do things that you would like to do instead, and be positive. Then try to understand your body better. You are someone who's the best therapist for yourself. If you can understand these principles well, you can just chill out a bit on the injuries, and you can explore what ranges of motion are feeling uncomfortable. Sometimes you get someone to do some stretching for you, right? And you get in a range of motion that feels really overstretched and you feel pain, and it feels uncomfortable with the person is like, no, just wait, let me stretch. That range of motion is probably not great for your joints. So you know what's best for your body because you understand where you experience pain, you understand what is off, you understand what is not very comfortable, gives you some discomfort, and try to understand your body better and see how and what works in terms of rehabilitation. And why do athletes always recover faster than gym goers, right? I've got multiple athletes that I work with. I coach all three of these athletes. First one here is Jeshua. He has represented Team India recently. He has an ACL tear here and he's already back on court. He is recovering well. Then we've got Parth. I told that this guy he plays for Team Maharashtra. He's got 2 ankle ligament tears, 3 ankle ligament tears. I wrote 2. He also had a wrist ligament tear. And he was back on court within a month, okay? He had 3 complete ligament tears. He followed everything that I told him. He followed exactly what I told him to do, coached him exactly the right way, and he started following his ligament injuries and the rehabilitation protocols that I shared, and he came back to his sport within a month. So that's great. Then we've got Sekon, who's the current starting 5 athlete in Team India men's. So he's a very prestigious international athlete. He's been representing India for a very long time now. He doesn't have any injury, but these same protocols which you can do to recover your injuries, these same protocols can be used for recovering your muscles and recovering from intense practice sessions. Sometimes you feel some certain discomfort in your joint, which just feels off, right? Maybe you have been playing a lot, you've got serious practice going on for like weeks. Your joint starts feeling a bit wobbly, starts feeling a bit uneasy. So you can still use these same rehabilitation methods to improve the condition of your joint even after. And the best part about why athletes recover fast is because they miss being on the move, right? With athletes, they get injured and they're like, I want to get back to court, I want to get back to the field, I want to get back to the gym. And that restlessness actually helps them heal. Now, some people get stupid, okay? They try to push past the pain. You don't want to do that. But staying active and mobilizing as early as possible, is good for joint health, and it actually helps. You don't want to be the guy who gets injured once and doesn't show up to the gym or to the court for 2-3 months straight. You don't want to do that. Early mobilization actually helps in overall joint recovery. So finally, what all do? You can initially rest for the first 3 days. You can take a chill pill, and then you can start elevating, compressing, and start loading your joints eventually. And is this the last slide? Let me see. Yeah, so this is the last one. So that's how you recover with your joint injuries. Take a chill pill initially. Do everything you can to recover the joint, and eventually you'll start seeing some better progress. A lot of people, they just ignore their injuries. They don't do anything about it. If you got an elbow tear, you want to figure out which exercises gave you this elbow injury, not tear tendonitis. So a lot of people get elbow and wrist injuries because of barbell curls. People don't recognize that and they ignore it. You want to recognize what caused the injury. You want to avoid those movements if possible. You can definitely avoid these exercises because we've got alternate exercises which stimulate the muscles as well too. So avoid what hurts. Try to train your joints in a range of motion that is comfortable for the joint health too. Not just good for muscle mass, but also comfortable for the joints. And then eventually you want to cut down on exercises that are not worth it. And then if you get injured, don't try to push past it. Just take a chill pill, rest for a while, and start active work on the joint. Okay, consider your joint as your new hobby or your new passion. Do everything that's possible. Elevate it, compress it, start loading the joint, do anything and everything. So that's all about joint rehabilitation. I hope this helped you guys, and I'm going to end the live here. What I will do is end this live and start another Q&A to answer all of your questions. So here we go.